Hello, my name is Josephine Gatua, a health economist at the Nigeria Center for Disease Control in the AMR unit. In this module on economic evaluation, aims at helping us understand how to determine whether the various AMS programs are cost effective. As a starting point, we recap on what is antimicrobial stewardship. Antimicrobial stewardship is a set of coordinated strategies to improve the use of antimicrobial medications with the goal of enhancing the patient's health outcome, reducing resistance to antibiotics or antimicrobials, and decreasing unnecessary costs. Having said this, it's one definition that can be broken down into segments. In the world over, antimicrobial stewardship programs have been hailed as a solution to several outcomes, as has been mentioned in the definition of what a stewardship program is. It promotes the appropriate use of antimicrobials, including antibiotics. It improves patients' outcomes. It reduces antimicrobial resistance, including the multi-drug resistance microorganisms. But the main question that most of the decision makers will want to know is, what is the impact of the different AMS interventions that we are undertaking in our healthcare settings? And this is where health economic evaluations come in. The health economic evaluations, they provide decision makers with information on outcomes which decision makers can now use to attempt to maximize the health of the population. And that's where health economic evaluations come in. And these economic evaluations are used to provide outcomes by which decision makers can attempt to maximize the population health. Such evaluations will therefore aim to compare what are the costs, which we've seen in the previous slide, that we want to achieve our outcomes without wasting any coin, and the benefits, which we've looked at as it can be improving patients' outcomes, it can be reducing antimicrobial resistance, it can be reducing antimicrobial resistance, it can be promoting the appropriate use of antimicrobials. Those are some of the benefits that we're going to look at that are associated with a new intervention when you compare to the current status at the hospital, or if you want to look at two interventions of AMS that are you've started within the healthcare settings. So these costs and benefits will now provide an estimate of cost per benefit gained associated with implementing a certain intervention within the health setting. But the evaluation method that will be used to reach that decision of which intervention is more appropriate is you have to look at the outcome measure that is desired. The evaluation method will now determine on the outcome measure that is desired. In our introduction, we said that we want to limit the wastefulness of the resources. This is because in a given healthcare setting, the resources are finite, which means a health system is faced with very many needs, but they have very limited financial resources, and sometimes these resources are actually decreasing. So the hospital management is faced with a situation whereby they want to maximize the health of the population, but they have to do this maximization using the limited resources that they have. This, by default, brings the decision makers to a decision of what should be adapted, what should not be adapted, and why. But for them to make such decisions, they need evidence, which helps them assess these AMS programs are in place. Do they have sufficient benefits to warrant allocation of resources? Or they have a certain allocation of resources to either to 2 or 3 AMS interventions, but they only know that they want to choose one. So which one of them should they choose? the health economic evaluation methods will help them do that. And that's what we're going to delve in the next section. So the first method, which is the most commonly used, is the cost effectiveness analysis. In these methods, the benefits are expressed in form of some natural units, such as the death averted, life year gained, or infections prevented. So this will now be compared for each intervention. You will collect the benefits and then get the costs of each intervention and then compare them to get an incremental cost effectiveness ratio, such as the cost per life year gained, which helps the decision maker to make a decision. So in summary, the cost effectiveness analysis, you first collect the costs, which are in monetary terms of the intervention, and the benefits, which are health benefits which are non-monetary in nature, like the deaths averted, life years gains, or infections prevented. And then you make a comparison of associated costs and benefit between either the two interventions that you're trying to make a decision on. So if you're to practically do this, what you do is you have intervention 1 and you have intervention 2. You get the cost associated with intervention 1. You subtract the costs of intervention 2, which is now your comparator, and then you divide by the benefits of intervention 1 minus the benefits of intervention 2. The outcome measure you get is called the incremental cost effectiveness ratio. Once you have this ratio, you reach a decision rule because the ratio that you get is based on a certain threshold. So the decision rule will be made if this ratio is below a certain threshold, then this intervention should be undertaken. And if it is above, this intervention should not be undertaken. A second method, which is related to the first, with a slight difference, is the cost utility analysis. In this, we express the benefits in natural units. But the difference is these benefits are quality adjusted. For example, we have the quality adjusted life years, whereby the health status measure will incorporate the quality and the length of life. And this is a measure that ranges between 0 and 1, such that 1 will represent a full year, a year in full health, and 0 will represent death. So just like the previous method we've looked at, you will first get the costs, which are in monetary terms for the intervention, and then calculate the benefits in terms of the health utility benefits, which are measured in measuring quality and the quantity of life. And then you make a comparison of the costs and benefits of one intervention to the costs and benefits of another intervention. Once you do that, the outcome measure that you get is the incremental cost utility ratio, which helps you in making the decision within a certain agreed threshold. If the threshold is below a certain agreed threshold, you undertake the intervention, and if the threshold is above, you forgo that intervention. The third method that you can use is the cost-benefit analysis. In this method, the costs and benefits are expressed in monetary terms. So just like the previous methods we've looked at, you will get the costs and benefits of the first intervention, all expressed in monetary terms, and compare with the costs and benefits of the second intervention, also measured in monetary terms. The outcome measure that you get is the incremental benefit cost ratio, which helps you make a decision such that if an intervention, if the incremental benefit cost ratio is positive, then the net benefits associated with undertaking an intervention, and vice versa. Having said this, we've seen that there are different outcomes that an economic evaluation can take. But these outcomes have to be evaluated within a certain perspective. So the decision maker has to make a decision of, do we want to use the healthcare provider perspective, whereby you look at the costs and benefits accrued within a health setting? Or do you want to expand to include societal perspective, which will include productivity losses incurred because of, for example, admissions, caregiving by relatives and friends of the sick. So once a decision is made, then you will collect the costs to reflect the perspective that you are interested in, and state that on the outset that this is the perspective that this analysis is going to take. Decision makers also have to keep in mind that the AMS interventions are usually bundled interventions, whereby we can actually evaluate multiple interventions. As we've seen, is a set of strategies, and these strategies, for each strategy, that's an intervention. So they can be compared against each other to get which is the most effective to be undertaken given the resources. One other major thing that decision makers have to keep in mind is, in a hospital setting, there are many competing wants from different units within the hospital. And sometimes the decision maker has to make a decision of, should we first adapt this AMS program before we adapt this other program in a different unit, or should we do vice versa? So this means that the first thing they need to check is, do we have an outcome measure in the two units, if it's the AMS program and another program that has similar health outcomes that can be evaluated? If you get health outcomes that are similar, then you undertake one of the methods, either cost effectiveness analysis, cost benefit analysis, or cost utility analysis, to help you make a decision on which intervention should you undertake within the healthcare setting. And I hope with this, you're able to get a snapshot of what can be done when you want to make a decision making on which intervention to adopt. A second key thing is, for you to undertake effective economic evaluation, there's one thing that clearly stands out. You need data. The costs that we are referring to come from within the programs that are being undertaken within the hospital. This means that the costs have to be accurate, the costs have to be consistent, and the costs have to be timely. We also have the benefits. This means that we need to consistently collect the correct data, which helps us say, these are the benefits of this program and these are the costs of this program. So the underlying quality of the economic evaluation is strongly based on the type of data that is available. And that's what strengthens the evidence which the decision makers can actually use now to make sound decisions to maximize the health of the population. That is their ultimate goal. Thank you.